Hello, I'm Dr. Latham, and in our office we believe in creating a comfortable dental memory. A lot of people may have heard of sleep apnea but not know exactly what it is or just know a little bit about it. Sleep apnea is something that's pretty close to me because I do have some family members affected by it, and I have seen some of the things it's done to them. And some of the concerns with sleep apnea is, in the process of it, you're not getting the airflow you need to keep your blood oxygen levels high enough when you're asleep. And this can disrupt your sleep patterns. It can be really damaging to your health. It can be damaging to your mind even. We have seen patients that have early onsets of dementia or other mental problems because of undiagnosed sleep apnea that's affected them in their lives. Other things can be high blood pressure and a lot of other health issues that can stem from sleep apnea. Um, so what are some signs that you might have some sleep apnea? Snoring. Snoring is a big one that I hear from a lot of people that really have a high risk for sleep apnea, is that they snore a lot when they sleep. The snoring is actually the resistance of the air being able to breathe while you're asleep. And so if you're not able to fully breathe, you have that snoring sound that you make. And a lot of times that's restricting the airflow that you have and lowering those blood oxygen levels and keeping you from having a full, restful night's sleep that can really affect you in your life. Signs that you might look for is if you have high blood pressure, if you're a little overweight, or if you have just a really large neck, even if you're not overweight. If you snore, if you've ever caught yourself catching your breath at night, if you feel really tired during the day and you're not really sure because you had a full night's sleep, a lot of these things point to sleep apnea. If you wake up a lot during the night, a lot of these things can stem from just not being able to have that appropriate breathing and just having that resistance in the airways to breathing while you're asleep. So, how is the dentist can help with this? Well, there are a couple of ways. As a dentist, we're working very intimately with the head and neck and the mouth. And as such, we're able to see a lot of signs and that someone might be at a little more risk for having sleep apnea. A lot of times when I'm looking in there, I can really see that someone doesn't have a lot of airway available, either because of a large tongue or large tonsils. Those things are very visible to me the entire time I'm working with a patient. So it's a great opportunity to see if someone might have some of those risks for sleep apnea. Some of the things that are kind of quirky that many people might not even think of is dreaming. Dreaming happens in the deep cycles of sleep, and if you're not reaching those deep cycles of sleep because of airway restriction, that keeps you from dreaming. It also keeps you from having a very restful night's sleep. Feeling tired during the day, falling asleep regularly while either driving or watching TV or just any sort of casual activity, all those can be signs of some undiagnosed sleep apnea. If this is a concern for you, if you think you have any of these symptoms, please come in and visit us. It would be great to help you out and get you on a path and get you in touch with the right people to help you to improve some of those things, improve your sleep. You can visit us at lathamdental.com or call our office 745-9723.